Hi doctors! Today I will focus on attachment placement, analyzing all details for an efficient attachment design. We know that the predictability of tooth movement with aligners is due to patient compliance, diagnosis, treatment plan, which includes the sequence of movements, teeth anatomy, attachment design, and occlusal contacts. Remember that attachments are not always necessary for tooth movement since they are only the points on which the aligner applies its force. So tooth movement is due to the mismatch between aligner shape and the position of the teeth. One of the basic rules about the feature is horizontal movements require vertical attachments, while vertical movements require horizontal attachments. So, how do we know which is the right shape and size for each teeth? On molars, premolars, and deciduous teeth, it's better to use large horizontal attachments. Some others, in order to decrease the risk of mismatch, plan an occlusal bevel on posterior teeth and a gingival bevel on anterior teeth, even if the active surface of attachment seems to be flat and unbeveled. About attachment position, those placed gingivally were found to be the most retentive of all. For double attachments, remember that the one located more incisally decides the final direction of tooth movement since generates a greater moment. Now, let's analyze the different shapes of attachments. To improve root control during expansion or in case we have primary dentition or short clinical crowns, we can use traditional horizontal attachments to improve the retention. Vertical attachments should be preferred in case of distalization or tip control. If we give to it 45 degrees orientation, we obtain sash attachment, which is advisable for rotations. Finally, there is yin-yang attachment, which can be used during the mesialization of the posterior teeth. Remember that for each type of tooth movement, there is an appropriate attachment to be used. To avoid posterior crown flaring during expansion, we should use traditional horizontal attachments. All extrusion movements need horizontal attachment to be performed because, as we know, aligners only push the teeth but they don't pull. So I usually plan pure extrusion movements only if I can apply button cutout and elastics. For intrusion movement, remember to apply attachments on the adjacent teeth to provide an adequate anchorage and to avoid the aligner from lifting up. In order to avoid a distal crown inclination, apply a vertical attachment to create a couple of forces. To avoid intrusion during distalization, we can slightly incline the attachment. For mesialization greater than 2 mm, place 2 horizontal attachments to have a better root control during this movement. However, in extraction cases, I prefer not to move molars and premolars to close the extractive space in maximum anchorage. Of course, the most incisal attachment will go on the mesial part of the crown. While flat teeth don't require attachment for this movement, on canines and premolars we should apply a vertical attachment beveled in the opposite direction of the rotational movement. Finally, the attachment located more incisally marks the direction of the sum of forces generated by the two attachments. As always, for other tips, join us on Smart Aligner Service.